So as I said before, we are now actively listening to the patients. We are organizing regular patient summits, patient advisory boards, where UCB and the patient meet in order to share ideas and to share perspectives. We also have an innovative partnership with Patients Like Me. Patients Like Me is providing online communities to patients, and I will come back to it later. And last but not least, we're also listening to what people say about their disease on the web. And this is bringing very important insights directly from the patients into the company. Obviously, we not only listen to patients, we also deliver for patients. And so the R&D staff, for example, is in direct contact with patients, and this has a direct impact on the drug development process and on the drug we deliver. This is one very concrete example. It's the Nupro patch for people with Parkinson's disease. So most drugs for Parkinson's disease are oral drug, and they do induce what we call on and off period for the patients. So we therefore designed a patch which offers 24 hours continuous delivery of the drug directly into the blood of the patients, and this highly reduces the on and off periods of the patients. So this is innovation inspired by the patients for the patients. Another example is the Cimzia syringe. Cimzia is our drug for rheumatoid arthritis. So as I said, it's a disease that attacks the joints. So with a normal syringe, people are not able to self-inject their drug. So in partnership with Oxo Good Grips, which is an American company, we have designed this ergonomic syringe to allow people with rheumatoid arthritis to self-inject their treatment. So it's another example of innovation thanks to the input of the patients for the patients. Patients Like Me is another kind of innovation. So they're providing online communities for patients. So what we have done here, we have helped them set up a community for people with epilepsy. And by doing this, we are supporting the epilepsy community, but we're also gathering important data, important insights directly from the patients into what it is to live with epilepsy. This is a quote from a patient who joined the online community. And basically by joining the community, this patient heard about physicians who specialize in epilepsy. They're called epileptologists. And that person went to see an epileptologist, and the epileptologist found out that this patient was taking way too many drugs. That person was given a new treatment, and the person now says that he almost feels like a normal person after being over-medicated for 15 years. So this is really to show you the power of peer-to-peer interaction between the patients. In order to assess the value of such communities, we are doing surveys on a regular basis, and here you can see actually a few of the results. So half of the patients now better understand their side effects, they better understand the disease, they also better understand the seizures. And in the end, we've seen that by talking to each other, people realize that other people with epilepsy are actually seizure-free, while they are not. And as a result of that, they go and see a specialist. Most of the time, they are given a more appropriate treatment, which is most of the time, again, a newer treatment, which results in a better quality of life for these patients. We have also set up a new program. It's called Patient Advocacy Programs, where we have patients talking about their experience to UCB, to other patients, to caregivers, and to healthcare professionals. And the aim of such a program is to inspire, to educate, and also raise awareness of what it is to live with the severe diseases. And in order to support this program, we have a series of websites doing disease education. Today, we have more than 120 patient advocates talking to literally tens of thousands of patients around the world. So these 120 advocates have been sharing their experience with many people across all continents. The staff at UCB is also very much engaged into this patients' initiative. There are approximately 2,000 employees that are involved in over 75 local activities. And I'm going to give you two examples. The first one is Canine Assistance. So we are supporting this organization, and what they do is they provide seizure response dog. So these dogs are trained actually to detect early signs of seizure or to react appropriately in case of seizure. So we are supporting this organization, and we also do provide scholarships for young people living with severe diseases. This is a tool that we have developed in order to facilitate the communication between the patients and the healthcare professionals. It's called the Parkinson's Wellbeing Map, and it actually allows people with Parkinson's to record and track the evolution of their non-motor symptoms over time and then report it in an easy and accurate way to their physicians. Without such a tool, bringing this topic on the table with the doctor has proved to be very difficult. One last example to show that we are embracing new technology. We are developing several iPhone applications. This is an iPhone app for people with Crohn's, which again allows them to track the evolution of their symptoms on a daily basis. So, in the end, why are we doing all this? So actually, we're still assessing the impact of all these initiatives, but we believe that our approach is having a significant impact and a positive impact on the life of the patients. It also has an impact on the productivity in innovation. We believe that it's increasing the motivation and the pride of the employees. As I said before, it's also bringing a sense of urgency, a sense of getting things done. And also, very importantly, it enhances the attractiveness of UCB for new people, for partners, and for the payers and the local authorities. So, in conclusions, we are working in an environment where innovation is an imperative. You either innovate or you die. And while we are still doing innovation in a traditional R&D way, we are also developing new models of innovation, which are mainly based on working with patients as a driver of innovation. So, in order to survive today, we believe that we need to listen to patients, think of ourselves not only as an R&D organization, but as an organization that delivers solutions to the patients. So this is what we are currently doing at UCB, and we really believe that this will make the difference, first for the patients, but also for us. Thank you very much.